Before viewing video lessons, it is important to read the textbook using the learning guide as your turn-by-turn directions. Then, use the learning guide to take organized notes in your own words with examples and pictures. Chapter 1, Psychology Today. We've discussed a lot of the history of psychology. We want to end Chapter 1 with a discussion of where psychology is today. Today, we define psychology as the scientific study of human and animal behavior. We define those scientific study factors in terms of the biological, the psychological, and the socio-environmental factors of the biopsychosocial model. Psychology is also a profession that applies the science of psychology to practical problems. Some psychologists are both in the world of science, doing research, and in the world of application, doing some application of that science. But we also have some psychologists that are in one of those areas or another. Within research, in today's psychology, there are several broad areas of research. Today, one area of research is developmental psychology. This area looks at how we develop and change or remain the same over time. They might look at childhood, adolescence, old age, or the entire lifespan. Social psychology is an area that looks at the social factors that influence behavior. Educational psychology is somewhat related to cognitive psychology, but focuses on how we learn and remember and how we can best structure educational experiences. Some of the research that you used in the first orientation week, where you looked at the recommendations on good study habits, comes from the field of educational research. Health psychology looks at how psychological factors impact our physical health, as well as how our physical health impacts psychological factors. Think about how you felt the last time you were sick. Not only did you feel physically ill, but you may have also felt run down, unhappy, grouchy. There were psychological effects. This field of research will look at how those world of physical health and psychological health interact. Physiological research focuses on the physiological or biological factors that impact behavior. They may look at genetic factors or anatomy and physiology, and focus a lot on the nervous system with the brain, and also the endocrine system and the immune system. Experimental psychology or experimental research looks at doing true experiments in the field of psychology. As you will learn in Chapter 2, this is not always easy. Cognitive psychology looks at factors related to cognitive processes that influence behavior. They may look at things like memory, decision-making, those sorts of factors. Psychometric research is the modern-day version of functionalism. Psychometric focuses on how we can measure different aspects of psychology, usually with some sort of test. The last field of research in psychology is personality research. Personality is considered enduring traits, and so they look to see how those traits develop and also how we might change them over time. Some research falls in only one of these areas, but oftentimes an individual research study will overlap in multiple areas. A relatively small percentage of psychologists are focused on research. The vast majority of psychologists today are in the applied fields. These fields include clinical psychology, which developed first during World War II, and industrial organizational psychology that also developed first during World War II. Clinical psychology and counseling psychology today actually have very little differences. These two fields of psychology are both eligible to be licensed as a mental health provider in the state. There is no distinction on the state level between clinical and counseling psychology, so both psychologists are licensed to provide psychotherapy services. They will generally apply psychology to help people who have developed problems or disorders. Counseling psychology has a special focus on also preventing or intervening early. School psychology applies educational research, cognitive research, and other areas of research to the school setting. So they will take that information and work with teachers, work with the school district, and work with individual students. Industrial and organizational psychology applies psychology in business settings, sometimes to help the organization function more efficiently or effectively, sometimes to help with some sort of industrial process. So how can we design a better ski lift, for example, that might work better for how people actually use it? There's a final field that applies psychology, but it isn't a division in psychology. This is psychiatry. Psychiatry is actually a medical specialty. Psychiatrists are medical doctors who, after graduating medical school, where they learned about the entire physical body, spent a few years focusing specifically on psychiatry or medicine of the mind. Psychiatrists work with people who have disorders and usually will apply some sort of medical treatment to help with that disorder. There are many professional organizations in psychology. The biggest is the American Psychological Association, or APA. The Association for Psychological Science, APS, tends to focus more on the research areas of psychology. The APA does both. There are also numerous related organizations for careers related to psychology. In order to be someone who has the title of psychologist, you have to have a PhD in psychology. But there are numerous fields, in addition to psychiatry, that are related. For example, people with master's degree in counseling or marriage and family therapy are also applying psychology, but they don't hold the title of psychologist. Most professional organizations have free or low-cost student memberships, so you can explore these organizations if you're interested. On our course homepage in the web links folder, there are links to all the different organizations that are related to psychology.